I am writing today just to see if anyone else is going through the same kind of BS right now. It's about healthcare, obviously, and how messed up things are getting in this country. Like seriously messed up. I'm not gonna get all political ranty, even though, trust me, I could. But this is personal and it's scary as hell. See, I've got this pre-existing condition, nothing life-threatening right now, knock on wood, but it's chronic. It's called Crohn's disease. For those who don't know, it's an autoimmune thing that messes with your digestive system. Think really bad stomach cramps, diarrhea, fatigue, all that fun stuff. It flares up sometimes, and when it does, it's like being hit by a truck. Other times it's manageable, thanks to meds. The thing is, I've had Crohn's since I was 19. Diagnosed right before Obamacare kicked in, actually. Before that, getting insurance with this condition was a nightmare. I remember being denied coverage, offered plans with like $1 million deductibles, just straight up told, sorry, we don't cover people like you. It was insane and terrifying. Like you're already sick, and then you're stressed out of your mind about how you're going to afford to even stay alive. Then the ACA happened, and for the first time in my adult life, I felt like I could breathe a little. Pre-existing conditions were actually covered. It wasn't perfect. Premiums were still kinda high, but I could get decent insurance, see my doctors, get my meds, and mostly manage my Crohn's without constantly worrying about going bankrupt if I had a bad flare-up. It was a game changer. Seriously. Fast forward to now, and I'm starting to feel that old fear creeping back in. You know, with all the political back and forth, the constant threats to repeal the ACA, and now all this other stuff happening, it's like they're trying to chip away at it piece by piece, and it's working. I can feel it. The thing that's got me really freaked out right now is what's happening in rural areas. I live in a small town in rural Missouri. It's beautiful. I love the quiet, the nature, the community, all that stuff. But rural healthcare is already, well, let's just say it's not exactly top-notch to begin with. We had a decent little hospital here, St. Luke's, been around forever. Not fancy, but it was there. Emergency room, specialists, the whole deal. If I had a bad Crohn's flare or anything else, I could go there and get taken care of. But guess what? St. Luke's closed down last year. Just gone. Apparently they said it was unsustainable. Low patient volume, rising costs, all the usual BS. But everyone here knows the real story. It's because of the way healthcare is funded now, especially in rural areas. Less government support, more pressure to be profitable, which is a joke when you're talking about healthcare. It's not supposed to be about profit, right? It's supposed to be about keeping people alive and healthy. But I guess that's too much to ask these days. So now St. Luke's is a boarded-up building. Looks creepy as hell driving by it at night. And the nearest hospital? It's in Springfield, which is like an hour-and-a-half drive. On a good day. In the winter, with snow and ice, forget about it. And that's if you can even drive yourself. If it's a real emergency, you're talking about waiting for an ambulance to come all the way from Springfield, assuming they even have one available and aren't tied up somewhere else. It's terrifying to think about. And it's not just the hospital closing, it's everything else too. Doctors are leaving rural areas because they can't make a decent living. Specialists? Forget about it. You gotta drive to the city for everything. And public health services? They're getting cut to the bone. Remember during the pandemic when public health was like the only thing keeping us from total chaos? Now it's like everyone's forgotten about that. They're defunding public health departments, politicizing basic stuff like vaccines and masks, making it harder and harder to actually keep people healthy. It feels like they're deliberately dismantling the whole system, especially in places like this, places that are already struggling. And for what? So some rich dudes can get richer? So they can score political points? It's disgusting. And then there's the insurance premiums. Even with the ACA, my premiums have been creeping up every year. It's getting to the point where it's a serious chunk of my paycheck. And for what? For a plan that still has a high deductible and copays? For a plan that might not even cover everything I need for my Crohn's? It feels like I'm paying more and getting less every single year. And with the way things are going, I'm honestly worried about next year's premiums. Will they be even higher? Will my plan even still exist? Will they decide to just drop coverage for pre-existing conditions again, now that they think they can get away with it? I know I sound paranoid, but honestly, it feels like they're trying to squeeze people like me out of the system. People with chronic conditions, people who need regular care, people who aren't perfectly healthy and productive. Like we're just a burden, a drain on the system, and they're making it harder and harder for us to survive. Okay, so here's the scary part, the thing that really pushed me to finally post this. It happened last month. I had a Crohn's flare-up, a bad one, like the worst I've had in years. Started with the usual stomach cramps, but then it just escalated. Fever, chills, couldn't keep anything down, the whole 9 yards. I knew I needed to get to a doctor, but St. Luke's was gone. Springfield was too far to drive myself. I was way too weak and dizzy, so I called 911, figured that was the only option. Waited and waited and waited. It felt like forever. Finally, the dispatcher calls back, says they're sorry, but there are no ambulances available in my area right now. They're all tied up with other emergencies. Seriously? No ambulances in an emergency? What the actual fuck? I'm freaking out at this point, lying on my bathroom floor, sweating in excruciating pain, and they're telling me there's no one to come help. The dispatcher, bless her heart, she sounded really stressed too. She said she could try to call for an ambulance from further out, maybe from a neighboring county, but it could take a while, like a long while, and no guarantees they'd even have one then. So there I am, alone, sick as a dog, with no way to get to a hospital. I honestly thought, for a minute there, that I was gonna die. Just lying there on the floor, waiting for help that might not even come. It was the most helpless, terrifying feeling I've ever experienced. Eventually, after what felt like hours, it was probably closer to 45 minutes, but still, an ambulance finally showed up. Turns out they had to pull one from way out in the county, from a volunteer fire department in some tiny town I'd never even heard of. The paramedics were amazing, don't get me wrong. They were clearly overworked and stressed, but they were professional and kind, and got me stabilized and transported to Springfield. I spent 3 days in the hospital in Springfield. They got the flare-up under control, adjusted my meds, and sent me home. Physically, I'm mostly okay now, still recovering, still tired, but I'm getting there. But mentally, emotionally, I'm still messed up. That feeling of being alone and helpless, of knowing that in a real emergency there might be no one there to help you. That stuck with me. It's shaken me to my core. And it's not just me, right? This is happening all over rural America. Hospitals closing, emergency services stretched thin, people losing access to basic health care. And it's not just rural areas either. Premiums are going up everywhere. Insurance companies are finding more and more ways to deny coverage, and the whole system feels like it's on the verge of collapse. I keep thinking about that dispatcher too. She sounded so defeated, so resigned, like this was just normal now. No ambulances available? Too bad. So sad. And that's what's really scary, that this is becoming normalized, that we're just accepting this as the way things are now, that we're letting them get away with this. I know this is a long post, sorry for the wall of text, but I just needed to get this out there. I needed to see if anyone else is feeling this way, if anyone else is scared. Because honestly, I am. I'm terrified of what's going to happen next. Terrified of the next flare-up. Terrified of another emergency. Terrified of losing my insurance altogether. Is anyone else out there feeling this way? Am I just being paranoid? Or is this actually happening? Are we really just letting our healthcare system crumble around us? And what the hell are we supposed to do about it? Seriously, any thoughts, advice, or just commiseration would be appreciated. I feel like I'm screaming into the void here. Stay safe out there. And try to stay healthy. If you can even afford to these days. This country, man. Shaking my head.